Okay guys, so we're back. Dr. Truesdale here. Today we're going to talk about the nose, and in particular, we're going to talk about ethnic rhinoplasty. So let's dive in. What is ethnic rhinoplasty? So when people talk about ethnic rhinoplasty, what they're talking about is rhinoplasty and typically skin of color, right? So it's not the typical Caucasian rhinoplasty. I don't love this term, but I have to deal with what we have already established. So typically people are talking about Asian rhinoplasty or black rhinoplasty when they're saying ethnic rhinoplasty. So ethnic rhinoplasty is very, very specific, and it's important to understand that all noses are not the same. Noses that come from a certain ethnic background typically have certain features that might be more common in that background. Not to say that any specific ethnicity has one set of features, because that's not true. If we look at black people, for example, some black people have very wide noses, some have thin noses, some have thick skin, others have thin skin, others have nostrils that are flared, others don't. And so there's not one specific type of nose for any specific type of person, but what we see in general are certain kind of trends. Typically in a black nose or an Asian nose, the cartilages are softer. They're not as strong. And so what that means is when we're trying to create beautiful shape, we have to typically deal with that weak cartilage and add support. Or we're gonna do suture techniques to change the cartilage to give it more rigidity. So those are things like structural grafts, like rim grafts, or maybe we're gonna do a caudal septal extension graft to create more projection of the nose. So typically with an Asian nose, it might be more flat. With a black nose, maybe less defined bridge. We might add cartilage to those areas to create a bridge. And we have various techniques to do that. We can do rib grafting. So we take rib from the patient and we can actually shape it to create a bridge. We can use donor cartilage from a cadaver or from another source to actually build a dorsum. We can use implants. I typically don't like implants, and I think that's a mistake. The reason why I don't like implants in the nose is they can cause a lot of problems like this or like this. Extrusion, infection, shifting, right? It can look really unnatural. I like typical organic material to be placed into the nose because that integrates better with the nose, less risk of infection, and it typically looks more natural. So whether you're dealing with a black nose, an Asian nose, typically you're adding structure in. The other thing that's specific with ethnic rhinoplasty is the skin thickness is different. Typically in a black nose and an Asian nose, the skin overlying the cartilage in the bone is a little bit thicker. Now the implications for that are multiple. Number one, it means that the final outcome is going to take longer to get there. The recovery typically is going to be a little bit longer because that tissue holds water. The more tissue you have, the more water that the tissue can hold. And typically it takes longer for you to see that nice, beautiful definition that can be created in the nose. The other things that are important, when you're dealing with that thick, soft tissue, right, it can make it harder to see the beautiful definition. So if you imagine the analogy that sometimes I give patients, if we're trying to create a really nice structural frame, right, where we can see nice definition, highlight points, or just really nice beauty, imagine taking a bed frame, right, which is rigid and has structure, and then you cover it with a very thick down comforter. It's hard to see those little edges and that really nice shape underneath. But if you exchange that really thick blanket for a thin sheet, like an Egyptian cotton sheet, you can see all the little contours, right? The little beauty underneath. It's the same thing with rhinoplasty. Now, when we're doing ethnic rhinoplasty, we need to control the skin thickness and furthermore, the scar that might be deposited after we do rhinoplasty, because if we don't, a thick scar can form underneath the tissue. Now, how do we do that? Sometimes we remove actual fat and adipose tissue in the nose to create more opportunity for that definition to shine through. But if we take away that volume, we need to replace that size with something else, either structural grafting, or we need to do special suture techniques to seal the skin down. You can use tretinoin, actually prescribed high dose retin-A, which can actually make the fat and the oil producing cells of the nose quiet down. So sometimes we use that in rhinoplasty and ethnic rhinoplasty to speed up recovery and to decrease the risk of there being a dead space or an area where fluid will develop and form scar later on. Some people will actually suture special silastic sheets down to the structural nose, and that basically takes the potential space, the space that can fill up with fluid, and it seals it down so that we can control the tissue and it doesn't swell up like a balloon and fill with scar tissue. Sometimes we put structural grafting in or cartilage to actually push into the tissue of the nose. If you think about it this way, right? My shirt here, you can't really see anything underneath my shirt, but if I take my finger and I push into my shirt, you can see that definition. We use that same analogy when we're doing ethnic rhinoplasty or really any rhinoplasty. We create pressure and project into the skin to create more definition. So ethnic rhinoplasty can go terribly bad. We have all seen some very famous examples. And what is typically going on with this? The number one problem, and it's a huge pet peeve of mine, really any plastic surgery, is that they're not respecting the person's ethnic features, right? So what I tell my patients is, I want you to look like this nose fits your face. If I put Pamela Anderson's nose on my face, not good. If I put Nicole Kidman's nose on my face, will not look good. And why is that? It's because it doesn't fit. The nose should blend in with the face. There's very few times when you look at a beautiful person, you say, wow, their nose is just so gorgeous. They have a gorgeous nose. Typically, that beauty and kind of that focus is on the eyes, maybe on the lips. Some people might have a beautiful nose, but there's very few beautiful people who you're looking at their face and saying, wow, I just admire their nose so much. Typically, you want the nose to just blend in, almost like it's a backstage helper. It fits with the eyes, the lips, the overall facial harmony, but you don't want it to stand out and take too much center stage. So the same is the case when you have an ethnic nose, right? If you put a nose on me that doesn't look right, it takes something away from the beauty there and it's distracting. I hate when that happens. It's important to do sometimes smaller things, more nuanced things, than to take a nose that's really wide and then you make it too small, it just doesn't fit. Same can be said for making a masculine nose look too feminine or a feminine nose look too masculine. It just doesn't look right. Other special considerations for ethnic rhinoplasty. In terms of the recovery and the healing, a lot of times we want to do adjuncts so that we can control that soft tissue swelling. I like to encourage taping, not just for my ethnic rhinoplasty patients, but for all of my patients. Taping basically strips that we put on the nose, seals down, and it helps prevent soft tissue swelling. It controls that swelling in that initial healing phase. So like I said before, there's not excessive scar that's laid down. It's very important when we're thinking about ethnic rhinoplasty. So we've reviewed a lot about ethnic rhinoplasty. I love doing noses. If you want to learn more, definitely click the link below. If you want to check out more videos, here it is here, and I will see you guys soon.